Hey folks, it's Dr. Gerstmar from Aspire Natural Health. Today I wanted to tackle the question of, is it really important to get tested for celiac disease? And this is really targeted at people who've taken wheat out of their, or gluten out of their diet, whether it's because they read something or they found that when they don't eat wheat or gluten, they actually feel better. So that's a pretty common experience here in my practice is someone has said, when I eliminated gluten or wheat from my diet, now just to be clear, gluten is a protein that is inside wheat, barley, and rye. So when we talk about eliminating gluten, necessarily, if you're eliminating gluten, you're eliminating wheat, rye, and barley, and anything made with those grains from your diet. So people will say, I eliminated gluten and I feel better for having done it. And then invariably, my question to them is, have you been tested for celiac disease? And they say, well, I'm not actually eating gluten, or I only eat it once in a blue moon. Do I actually need to be tested for celiac disease? And this is where, I come in and say, yeah, it is actually important to know because at the end of the day, celiac disease, whether it's non-gluten non-celiac gluten sensitivity, sorry, got a little mixed up there, non-celiac gluten sensitivity, which would mean it's not celiac, but you're still gluten sensitive, or wheat allergy, or any one of these things where you are avoiding it and you feel better, at the end of the day, the treatment is still avoiding those foods. But the consequences of eating those foods are completely different. So if you are just gluten sensitive or have an issue with FODMAPs or whatever it might be, but it's not celiac disease, then the reality is you eat gluten and you just feel bad, whatever that means for you, whether it's some gut symptoms, some diarrhea, or some a little bit of pain, or some skin rashes, or whether it's joint pain or whatever it is an immune reaction, and it's not feeling good or feeling bloated or feeling tired. But at the end of the day, you have those symptoms, and then you just have the choice to, keep eating it and keep feeling bad, or stop eating it and feel better. Okay, and that's one thing. And the reality of living with non-celiac gluten sensitivity is you really should just not eat gluten, right? Do your best. If you get some exposure once in a while, you don't feel very good, but then you just, go on, stop eating it, and basically get back to normal. Now, the reality, if you have celiac disease, if you actually have it, is completely different. Okay? You've crossed that red line between gluten sensitivity and full on celiac disease. So, if you're not aware, celiac disease is a true autoimmune disease. So, it's not just an inflammatory reaction that might happen when you eat gluten and you feel kind of bad. It is a full blown autoimmune disease where your body is now attacking your body. And so in celiac disease, that can be against your digestive tract or it can be against other tissues or organs of your body. And so the reality is that when you get gluten exposure and you have celiac disease, you have literally swallowed some poison because your body interprets it that way, fires up your immune system, which then goes on to attack and begin destroying various parts of your body. So as you can see, there is a significant difference between an immune reaction and an autoimmune disease. The other piece is with gluten sensitivity, people may find that small amounts of gluten don't trigger those issues. So I can get away with a tiny exposure or a little exposure, but in celiac disease, even contamination, even tiny, tiny fragments of gluten can be enough to continue that autoimmunity. So, for example, when someone is diagnosed with celiac disease, they have to become really anal retentive about contamination. So that can mean someone cut a piece of bread on a cutting board, just wiped off any crumbs and then slapped down their gluten-free food onto that same cutting board and cut it up. Now, someone with gluten sensitivity probably not going to notice anything. Someone with celiac disease, that can be enough to keep that disease going. All right? So, it comes, having celiac disease versus just gluten sensitivity comes with a mental shift of, I can have some gluten once in a while. I'm going to pay the price, but it's worth it in this particular instance, maybe at a wedding or a special event or a birthday party or something like that, versus celiac disease, where the thinking has to be that it's really never worth it because the risks are substantial. So there's a specific type of cancer associated with celiac disease called intestinal lymphoma, radically increased while someone is consuming gluten. So the way you have to think about it is you're swallowing poison, which is dramatically raising your rates of cancer, among other problems, right? So again, it has to be taken very seriously. All right? I hope I've emphasized the reason that if you're gluten sensitive, it is worth getting a celiac test. In another video, we'll talk about the different types of celiac tests and when and where each one should be done. So if this is interesting to you, please stay tuned for that video. In the meantime, if you know you react badly to gluten and have not had a celiac test done, I highly recommend it. Because while at the end of the day, you're still going to be avoiding gluten, the reason, the rationale, the mindset, and the consequences of eating gluten are entirely different from one side of the line, gluten sensitivity, to the other side of the line, celiac disease. All right, folks, I hope you found this helpful. I am Dr. Tim Gerstmar with Aspire Natural Health. Our focus is on treating people with digestive problems, autoimmune diseases, and other hard to treat cases. All right? We never give up on our patients, and we're always focused on learning more so we can do better. If we can help you, please feel free to contact us at www.aspirenaturalhealth.com and check us out on Facebook at facebook.com/AspireNaturalHealth. Till we talk again, take care.